Hi, my name is Mary Ann. I am going to be demonstrating how to insert a indwelling Foley catheter. First thing I'm going to do is check my EHR, and I'm going to confirm that my patient is due for an indwelling catheter. So Anna Povolowski, so I will go ahead and go into the med room and acquire all of my supplies before going into her room. First thing I'm going to do is I'm going to get a wash basin. I'm going to get my Hibiclens cleaner. I'm going to get a wash rag and a dry towel. I'm going to have my hand sanitizer, tape to secure, extra procedural gloves, just in case I break sterility, which I hope not, an extra pair of sterile gloves. And I will also have my indwelling catheter kit. Before I do anything, I want to make sure that my packages are intact, dry, and within expiration date. They are. My indwelling catheter comes preloaded with all of the materials that I would need. So I've got that taken care of as well. My first set of rites that I'm going to do is within the med room. I am going to confirm in EHR that Anna Povolowski, date of birth 5/5/1957, with an allergy to penicillin and a reaction of hives, is in fact due for an indwelling catheter insertion. And today is 7/6, and it is currently 13:36, and that's what time it needs to be done. So I will go ahead and take the rest of my supplies, pile them all within my container so that I can go into the patient's room, keeping my EHR with me. So the first thing I'm going to do is knock on the door, introduce myself, and make sure that she has privacy by closing the drapes. I'm going to hand sanitize as I walk in. Hi, Anna. How are you today? I'm fine. My name is Mary Ann. I'm going to be your student nurse today. I'm here to insert a Foley catheter for you. Before I get started, can you please confirm your name and date of birth? Anna Povolowski, 5/5/1957. I confirm it against her wristband. I confirm it against my EHR document. Do you have any allergies to anything? Penicillin. I confirm it against your wristband and again against my EHR. And what kind of reaction do you have, Anna, with the penicillin? And she'll tell me, hives. And I've noted that that is the same that is within the EHR. Now that I have this, I will do my second set of rites while I am in here. Again, I will hand sanitize. And I will confirm Anna Povolowski, 5/5/1957, penicillin with a reaction of hives is in fact due for an indwelling catheter insertion. So again, I'm confirming I have the right kit, right patient, and right times. So I've done my second set of rites to confirm that I am doing what I am supposed to for my patient. I'm going to set my rites off to the side. The first thing I'm going to do is explain to her everything that's going to happen, just in case she's a little bit scared. So, Anna, I'd like to know, have you ever had a catheter before? Yes. Did you have any kind of issues with it? No. Okay. Well, the doctor wants me to put a urinary catheter in because you're having some trouble urinating. So I just want to let you know that that's what I'm going to be doing for you today. Okay. So I will go ahead and put on my first pair of gloves. They're just procedural gloves. I have already closed the curtain to make sure that she has full privacy. The door is completely closed as well. I have my gloves on. I've already got a trash can established just down here to my side, so I will not be breaking sterility. When I drop like a diva, I'm keeping my hands above my body and just dropping. You won't be able to see it though, unfortunately, but I'll try to put my hand closer in so you can see it. So the first thing I need to do is to make sure that Anna is at the right height. So I'm going to go ahead and raise her bed so that it does not hurt my back while I'm doing this procedure. And every time I do something, I'm going to explain to her what I am doing so that there's no confusion. Okay, so Miss Anna, what I'm going to do now is I'm going to go ahead and remove some of your blankets, and then I'm going to go ahead and clean your area for you before we get started. Is that all right? Yes. So I'm going to get my bucket. I'm going to go over to the sink and get mildly warm water so that it's comfortable for her. I am going to add into the water my Hibiclens so that it's in the water and not concentrated on my rag. And I'm going to go ahead and put my rag into the water so that it's getting all agitated. Okay. Anna, is it okay if I go ahead and uncover you now? Yes. So I'm going to gently uncover her, exposing her lower extremities. Okay, Anna, I'm going to go ahead and raise up your next bit, but I'm going to leave you covered on top so you stay warm, okay? Okay. All right. From here, she would normally be in the dorsiflex position, which is her knees are up. And I'm going to ask her to please relax and be comfortable and adjust her hips so that I can actually get into her perineal area. Being that I'm right-handed, I'm on her right side. So from here, I'm going to go ahead and put the bucket down between her legs. When I wash, oops, blocking the view. When I wash, I'm going to make sure not to use the same section of the rag on any part of her body. So I'm going to pull it up. I'm going to wring it out. And then I'm going to talk to her. Anna, I'm going to go ahead and touch you and clean you now. Is that all right? Yes. So I'm going to go to the distal side and wipe down. I'm going to rotate my rag. I'm going to come to the proximal side, wipe from top to bottom. I'm then going to take my rag and I'm going to turn it inside out. And I am going to wipe straight down the center. As I'm cleaning her, I'm also noting that I have identified the urinary meatus. It is exactly where it's supposed to be. I can find it nice and easily. So from here, I am going to go ahead and let go. I'm going to toss my dirty rag. I'm going to get my clean towel, and I'm going to gently pat her dry. And again, so as not to contaminate, I'm going to rotate the rag and pat her dry again so that now she is drying. I'm going to go ahead and remove all of those supplies. I am going to remove my gloves and hand sanitize. All right. The next part of the procedure is going to be a sterile procedure. So I need to make sure that I use my sterile techniques. The bag, when I open it up, I will utilize the bag as a garbage can, or I can utilize the can that is just right below me. I'm going to use it to the right side of me so that I don't cross-contaminate by crossing over my arms. So I'm going to keep it down and to the right. I'm going to open up my packaging, and I'm going to place the tab away or towards me so that I can first fold away. I'm going to do this between her legs. Miss Anna, I need for you to stay as still as possible because I've got my kit in between your legs. If you're uncomfortable, please just let me know, okay? Okay. So from here, I'm going to go ahead and start using my sterile techniques to make sure that I don't contaminate anything. I am going to, you can either use gloves or not. I'm choosing not to use gloves. Again, I sanitized. I'm going to open and push away. I'm going to open to the sides. And then I am going to use the flap only and bring it towards me. So as not to break sterility, the outer 1 inch is not sterile, but I still am going to try my best not to touch that. I am going to reach underneath and turn this so that it's more of a square. That way it doesn't block as much of the sterile field that I'm going to end up creating here. Okay, so from here I am going to pull out my first drape. There's two sides to it. This side, which is the shiny side, goes down. This is my waterproof pad. So I'm going to touch it on the corner, lift it, open it, come towards her head. My table's in the way. And I'm going to drop it down. It's not dropped in the correct position, but I absolutely cannot touch it now because it is sterile. I apologize, my house is too small. From here, I am going to, I have to break sterility by crossing it over this little drape, but I'm going to try my best to keep it as far away as possible. So I'm going to shift my kit away from me. It's a little more difficult being that I have a cotton sheet down below. All right, so from here, I'm going to go ahead and get my gloves. Using sterile technique, grab the outer edge of it, step back, place my thumbs in, and hands on. I'm going to use my fingers to grab the inside of the cuff. I'm going to use hitchhiker thumb, make sure that my thumb does not get in the way of putting on my gloves, and put my gloves on. Now I am sterile. From here, I'm going to go ahead first and I'm going to move my paper wrapper for my gloves. I now am allowed to touch this drape because it's sterile. So I'm going to go ahead and touch the top of the drape only and place it underneath her legs. And pull it down slightly so that I'm exposing just her perineum area. I'm going to open up my next drape, which is going to only expose just the specific area that I need. Anna, are you doing okay so far? Yes. Okay. It's going to take me a second. I need to organize my kit. So one more moment, okay? Okay. So I'm going to organize my kit. I'm going to pull my catheter out. I am going to dispose of the box. I am going to open my catheter while I am here and make sure that the clamp is in the closed position so that I do not forget. I am going to open it and lie it down within my drape. I have two cleaners I am not going to be opening, but I'm going to pretend to open them. So the first one is a hydrogen peroxide. I would open the container, I would pour it completely over the cotton balls, and then I would drop it like a diva into the trash. The lubricant, same thing. I would open it. I would place it all within this first tray because that's what I'm going to need for inserting the catheter. I would take it and drop it into the trash. I would go ahead and prepare my syringe. I will open the lid, drop it into the trash, and secure it properly to the injection port so that I can inflate the balloon. From here, I am now ready to go ahead and start my sterile procedure. So I'm going to slide over slightly. I am going to pull my forceps out and I'm going to begin to explain to Anna everything that I am doing. All right, Miss Anna, I'm getting ready to start my procedure. The first thing you're going to do is you're going to feel something a little cool because I'm going to clean the area. Using my non-dominant hand, I'm going to go ahead and spread apart the labia. With my tongs, I will use one cotton ball, go to the distal side, start from top to bottom. I will clean down. I will take it. I will drop it. I will grab one more. I will come to the proximal side, closest to me, top to bottom. Drop it. You doing okay, Miss Anna? Yes. I will do one straight down the center. for the urinary meatus, and again drop it so as not to break sterility. I am also dropping my tongs. From here, my non-dominant hand stays. My dominant hand will slowly pull apart the catheter so as not to expose the tip of it. Nope, still did not expose the tip. Bring it out of its packaging. Place it within. I could have done that earlier and probably should have done that earlier. I did not break sterility though because it did not touch the packaging. So I am touching it within the lubrication. And then from here, I'm going to bring it all just a little bit closer, and I'm going to explain to Anna the next steps. Miss Anna, I'm getting ready to insert the urinary catheter now. What I need for you to do is bear down lightly, just lightly, okay? Okay. I'm going to slip the catheter into the urinary meatus. I'm going to go about 2 to 3 inches total, but I'm going to push it in until I see urine come out. I now see a small amount of urine coming into the tube, so I'm going to go ahead and push it another 2 inches in just to make sure that it is definitely within the bladder. From here, I can let go with my non-dominant hand, and I can hold the catheter, and I will use different fingers. I will go ahead with my dominant hand, and I will press in the 10 milliliters of sterile solution so that it inflates the balloon, keeping it placed within her bladder. If I felt any resistance at all, I would stop right here, but everything is flowing properly. Since it has a tendency to want to back up, what I need to do is leave my hand on the plunger so that I can properly remove the syringe. I will use a clean portion of my hand. Again, I'm going to toss it to the garbage for now, but it will eventually go into the sharps because it is a sharps container item. From here, I'm going to say, Miss Anna, does everything feel okay? Yes. I'm going to, because I don't want to touch anything because my hands have been touching all of her. So I'm going to go ahead and remove my gloves, hand sanitize, break off a small piece of tape. This one doesn't want to have a piece on it. Which is why you should always carry 2 rolls of tape in your pocket. Typically, I would throw this away, but I have to leave it in place for now because of needing to use it over and over again. So I am going to place my tape onto the tube just to hold it in place. I'm going to hand sanitize, and I'm going to, just for safety's sake, put on another pair of procedure gloves. Oh my goodness, these are small. That's what happens when the hospital's out of the right size gloves. You have to go to the next size down. Okay, so from here, I'm going to go ahead and pull back ever so slightly to make sure that the balloon is seated properly on the base of the bladder. I'm going to give enough slack so that she has room to move around without it being tight. I'm going to take my tape and I'm going to place it just below the Y bifurcation on the tubing. I'm going to make sure that the bag is hung properly below her height so that it does drain properly. And I do have a hook down here below the bed. I am starting to notice a flow of urine coming through, so this is good. I'm going to go ahead with my last little bits of cotton ball, and I'm just going to go ahead and do a last little bit of peri-care. So once down, once down. I'm gonna rip this one in half. I'm going to use half of it to come down the center. I'm going to use the other half of it to clean the outside of the tube where there might be some sticky left on it. dropping it again. Now my sterile procedure is done. I will discard of all of my waste into the proper trash bin. And I will ask Miss Anna how she's feeling. How are you feeling? How did you tolerate that? That was fine. I'm so happy. I'm finally releasing everything from my bladder. Oh, I can imagine how well that feels. I'm going to go ahead and cover you back up again. That way you stay nice and warm. Alrighty. I'm going to lower your bed back down again. I'm going to use my knuckle just in case. Alrighty. I'm going to go ahead now and remove my gloves. I'm going to throw these away because they're small. Hand sanitize. Alrighty, Miss Anna, while I'm in here, what I'm going to do is I'm going to go ahead and document everything and make sure that everything's flowing well. If you have any questions, just feel free to ask me. So I'm going to go ahead and get on into EHR. I'm going to make sure that I pull up Anna Pawlowski, date of birth 5/5/1957, penicillin, reaction is hives, and that I have placed the Foley catheter, that the patient tolerated well, that currently, even though I don't have a measurement, the approximate value that I'm seeing within the bag is approximately 150 milliliters, which is a good amount of urine. So that was really holding on to her. So I'm going to go ahead and document that I see approximately 150 milliliters of urine. The color is yellow. The clarity is nice and clear. I did not notice any odor while I was doing my procedure. The size of my catheter was a 14 French, and that I did inject 10 milliliters of sterile saline into the balloon. Before I leave, I'm going to sanitize my hands again, ask her if there's anything I can do. Miss Anna, are you comfortable? Would you like to sit up? No, I'm fine. I think I'll take a nap. Okay, well, I'll go ahead and put your call bell right next to you, and I'll bring your table over that has your glasses so when you wake up, you have everything that you need. Is there anything else that I can do for you? Do you have any other questions? No, I think that's good for now. All righty. Well, I appreciate you working well with me. You did a great job. So I'm going to go ahead and leave. I'll come back in about an hour and check on you. Is that okay? Okay. So I'm going to go ahead and hand sanitize again. I'm going to open up the curtain. I'm going to make sure that the sharps is thrown away in the sharps container and everything else is thrown away in the proper bin receptacle. And I am going to sanitize on my way out, and I'm going to tell her, all right, Anna, see you in a short bit. Call me if you need me. Okay.